Growing up, I lived with my mom in a series of one-bedroom apartments and hotels in Haverhill and Lawrence, Massachusetts. For those of you who don't know, Lawrence is the poorest city in Massachusetts, and Haverhill isn't really very far behind. Although my mother was smart, motivated, and devoted to making my life the best that it could be, social circumstances unfortunately meant that she was never able to get much more than an entry-level job, and she was constantly at the mercy of layoffs. Spending most of my life without health insurance meant that I was astutely aware of the power that medical care could have. My few trips to visit doctors, often ER physicians, had impacted me in powerful ways. Doctors could easily solve the incessant phone calls from school demanding that I got a tetanus shot before I could return to class. Doctors could sign papers to help you get food stamps and WIC vouchers. Doctors could even point people towards jobs and opportunities in their community. And later, when a close family friend was in a big, scary hospital in Boston, sick with leukemia, I came to see that doctors could truly be supermen. And before I knew it, being that Superman had become my goal. So you can imagine the shock that I got when I took a year off after college and discovered that there was this thing called public health that could do the same things but for lots more people. To say it was a conundrum was a vast understatement, and I ended up coming to the only logical conclusion that I felt that I could make. I would just have to get both degrees. So I had decided to go to Tufts University for a combined MD, MPH, where I would take courses concurrently and receive both degrees in just 4 years. When I arrived at Tufts, I saw that most of my dual degree classmates were similarly excited about social advocacy, social justice, and the power that medicine can have to change lives in both scientific and non-scientific ways. I also realized that my dual degree classmates, unlike the rest of my MD classmates, were all really interested in primary care. Although primary care was appealing to me, I still wasn't really sure. I'd found that in the classroom, primary care topics just weren't as exciting as things like cancer or infectious diseases that I found to be more exciting. So what was it that brought me over to primary care? In the end, there were two things that did it. So first, we started hearing about the wonders and virtues and magical powers of primary care in the very first day of our public health classes, as we talked about the Affordable Care Act, accountable care organizations, patient-centered medical homes, and the social determinants of health. The theme of the conversation always kept coming back to the same thing. Primary care could do that. Primary care could fix those problems. And although we all agreed that primary care wasn't really doing that right now, it was clear that nobody in the healthcare system was doing much of any of it. As we talked about solutions to the various problems that faced healthcare in America, I came to realize that the specialty with the superpowers was actually primary care. Because although specialists could cure diseases that I'd never even heard of, primary care had the potential to bring wellness to an entire nation. The second thing that pulled me over to primary care was Tufts Competency-Based Apprenticeship in Primary Care, or CAP. After courses in patient interviewing and physical diagnosis skills, all Tufts Med students spend 1 day a week in a family medicine clinic from the end of first year through to the end of second year. While scheduling for CAP, students were asked to contact the course director if they had any experience speaking foreign languages. Spending my summers with my grandmother in Quebec, I had learned French from a very young age and had gone on to study Spanish and Portuguese as an undergraduate at Harvard, across the river. So before long, I found myself assigned to Union Square Family Health, which is a patient-centered medical home in Somerville that sees a large proportion of Brazilian and Latino patients. But saying that Union Square is a patient-centered medical home honestly feels like something of an understatement to me. They were recently named one of the top 30 community health centers in the nation by the Robert Wood Johnson Foundation, and are a nationally recognized paradigm of what the future of healthcare should look like. Working there under the tutelage of Monica DeMasi and Kirsten Meisinger, I found that for the first time, I was around doctors who I actually wanted to be like. Although they were teaching me the ins and outs of primary care medicine, they were also teaching me to never forget a patient's social circumstances. When I discussed my assessment and plan for each patient, it was important that I thought about the social obstacles that might hinder our patients receiving their care and come up with a plan of what I could do to help that care happen. If a patient needed an x-ray, it was important that I'd ask how they intended to get to the imaging center. And if they had no way of getting there, I needed to explore what transportation options they could use to get there. As a child, physicians had often ignored my own social circumstances when they were planning my care. So having the chance to work with physicians who took the social context of their patients as a critical part of their approach to care was incredibly inspiring to me. I honestly couldn't believe that there were doctors out there who thought this way. It was really, really, truly inspiring. And as I thought more about it, I came to realize that Dr. DeMasi and Dr. Meisinger were in fact the Superman, or rather, superwomen doctors that I had idolized the most as a child. As I grew as a medical student, I came to experience more and more exciting things in primary care. I helped Dr. DeMasi in her group visit project for Brazilian diabetics, and later returned to help Dr. Meisinger start a group visit for new Brazilian mothers and their babies as my MPH senior thesis project. I increased my fluency in Spanish and Portuguese, and I before long realized that I had in fact memorized all of the generic drugs on Target's $4 prescription list. I learned about the requirements for our patients to apply for things like food stamps and WIC, and I also learned about the different social organizations in the community that could benefit our patients and help them to receive more effective care. What's more, I finally had a chance to see higher level public health topics that I'd talked about so much in my classes working perfectly on the ground in the context of a patient-centered medical home. So finishing CAP in second year with something of a spring in my step, I spent most of third year realizing that inpatient medicine was absolutely not for me. I realized, though, that medical students at schools without significant exposure to primary care and public health might easily pass over specialties like family medicine and other primary care specialties just because they hadn't been exposed to it. I mean, from the point of view of a student who only knows primary care as high blood pressure, diabetes, and high cholesterol, it seems quite a bit less interesting compared to the excitement of things like pheochromocytomas, Creutzfeldt-Jakob disease, or aortobifemoral bypass surgery. And I realized that this was true because at the beginning of medical school, I had been that student. I'd realized, though, that primary care is so exciting and thrilling for me because it's multifaceted and allows for extensive innovation every day. I'd rather spend my days doing lots of different things like delivering babies, prescribing medicines to help patients combat drug addiction, running group medical visits, running a clinic, talking about contraception and pregnancy options, and even informing health policy decisions at a local or even a federal level. This to me was much more exciting than removing one pheochromocytoma after another all day long. No offense intended to Atul Gawande. I've realized, though, that medical students who haven't seen the exciting innovations that Tufts has shown me just aren't as excited or thrilled about primary care as I am. I thought about what this means for a nation that's looking to build a pipeline for new primary care physicians. And to be honest, it really scares me. I've realized, though, that everybody's path to medicine and through medical school is different. But living in a world where fewer and fewer medical students are choosing primary care, we really have to think critically about how exactly they've been exposed to it. The truth is that every job can become boring if you do the same thing all day, every day. Truly engaging and exciting careers are ones that make every day different and require innovation and creativity. If we can make sure medical students see primary care as having all of those characteristics, I think that we can make it a much more attractive option. Thank you.
How do I turn this on?